I'm scared. I'm really scared. Not about this. This is great. You all seem like nice people. What I'm scared of is my future, or what my future might do to me. We all know the benefits of wellness, but we don't really want wellness. Not for doctors. And as a future physician, that keeps me up at night. Right now, as a medical student, nearly 1 in 4 of my peers likely suffer from depression. And the outlook only gets more grim. Once I become a physician, my likelihood of committing suicide becomes more than double that of the general population. Unfortunately, that's not all too surprising, considering 1/2 of all physicians suffer from burnout at some point in time. So yeah, I am scared of my future. But I am also determined to fix my career before my career can break me. There are a lot of reasons for you to care about physician mental health. Think about your worst day ever, your absolute worst case nightmare scenario. A car accident, a heart attack, a loved one's stroke. Chances are that worst day lands you in the ER, and then, in your critical hour, where sometimes even every second counts, if the physician seeing you is suffering from burnout, they may be more prone to error. Your health is tied to your physician's mental health. And this is even bigger than you and me. This is impacting the workforce and the economy. We are in the midst of a physician shortage, but doctors are reducing clinic hours and leaving the workforce earlier, piling even more work onto those physicians who continue to practice. A study found that workplace stress itself costs the US economy $42 billion per year. So what is going on? This thing that could cost us money, could cost you your health, that could cost me my life. 2,540 hours. That is how much time I will spend during medical school practicing procedures and skills with patients. Everything from asking the right questions to delivering babies. And that's time well spent, because these human experiences are what drew many of us to medicine in the first place. Then one day, we become full-fledged physicians, responsible for more than just patient care, unceremoniously saddled with insurance paperwork and hospital administrative forms, and technology that was supposed to make our days easier, but instead has been twisted into a marathon of box clicking that doesn't even improve patient care. For every 1 hour a physician gets to spend face-to-face with their patients, a physician must spend 2 hours facing a computer. And at the end of the day, physicians are spending a total of 2 extra hours at home on their computers catching up. These non-clinical burdens deteriorate the human element we cherish and train for. Let's go back to that worst day ever. Back into the ER. Look around, and what do you see? A child crying, a distressed father yelling, EMTs rushing in a patient who's gasping for breath. There, in the emergency department, abnormal is the norm. But those life events that land you there, at their core, are still unsettling and emotionally packed. Your worst day is our worst day too. And it's also just another day on the job. Critical incidents, like traumas or sudden infant death syndrome, their inherent stress builds inside providers, and for some physicians will turn into PTSD or burnout, potentially leading to the decreased clinical decision-making that results in worse health outcomes for you, the people we've committed our career to helping. What if physicians didn't have to suffer in silence? What if providers could come together after a critical incident and take a moment to vent, rehash what happened, remind themselves of the good amongst the bad, that they had genuinely tried their hardest? This defusing process is gaining traction for emergency department staff. By humanizing these difficult experiences and giving providers a chance to talk and connect, this intervention may mitigate negative stress impacts. And for the rest of the mental health morbidities that physicians face, therapy, medications, these mental health services continue to build a growing body of evidence attesting to their benefits. So is that it? Did we do it? TED Talk over, we solved burnout. Not quite. If we know where the problems lie, and we have these solutions that may mitigate their impact, what's the hang-up? Let me put it this way. You can lead a horse to water, but you can't make it drink, especially not if the other horses on the team aren't drinking. And definitely not if all the unbridled horses, the equine society at large, would judge that horse for drinking. And certainly not if the person holding the reins actually told the horse, it couldn't even be a horse if it drinks. Okay, this sounds ridiculous, and it should. This is what's happening with physicians and mental health services. Let's take a closer look at those horses on the team. The culture amongst doctors, residents, medical students, we idolize the workhorse, the one who works 36 hours straight without taking a single sip of water. Haven't you heard? Good medical skills come to those who don't sleep. We are praised when we make sacrifices for our patients, and we feel like superheroes when we do those things that make other people say, I don't know how you do it. But this culture of physicians as superheroes is hard to reconcile with a culture that accepts mental health support. The dirty secret is physicians are dying. And some of those brave enough to seek out help feel compelled to do so under the cover of false names and cash payments. I want to share a quote with you from Lyman Beecher, born right here in New Haven, Connecticut, a champion of social equality. The practice of physicians suffering in silence is a means which the culture of physicians renders necessary for protection of career and character. Then there's all those unbridled horses, the greater equine society. That is all of us here in this room and those of you watching at home. I'm going to ask you to do something really uncomfortable. I'm going to ask you some questions, and I want you to be deeply honest with yourself. Feel for the edges of any unconscious bias, any knee-jerk feelings that arise. Please close your eyes. If you knew your doctor had a history of depression, would you question their judgment? If you knew your doctor was on anti-anxiety medication, would you question their competence? If you knew your doctor saw a therapist, would you judge them? Open your eyes. Lyman Beecher drives this point home. Public opinion is in favor of physicians suffering in silence and compels one to sacrifice their reason, conscience, and wishes to the respectability of their social standing. We can't forget about the person holding the reins, because the message from the top is clear. Medical school sets a precedent for grueling hours and diminishing self-care. The residency programs we start afterwards are oftentimes equal parts training and hazing. And for physicians, many hospitals fail to create stress management programs that would teach and promote practices like defusing after a critical incident. A study of medical licensing boards, a board that is supposed to act in your best interest, found that many state boards ask physicians mental health history questions that teeter on illegality and stigmatize physicians who utilize mental health services. Lyman Beecher summed this up. Physicians suffering in silence does not prevail because the penalty of law is inadequate, but because it is never inflicted. So I need to tell you something. These quotes that I've been sharing with you to discuss doctor culture, societal stigma, government oversight, I edited these to be more topical. And here is what they originally said. These quotes are about dueling, and here is where I got them from. An anti-dueling sermon issued by Lyman Beecher in 1806. He felt driven to write this after the infamous Burr-Hamilton duel, which left one of our founding fathers, Alexander Hamilton, dead. This seems so bizarre now. People feeling so compelled to protect their honor by shooting at each other. Society expecting them to do so, and the government reinforcing it by not enforcing anti-dueling laws. And this was a defined period in our nation's history, a time when society at all levels encouraged bad decision-making that only led to harm and death. I'm still scared of my future, but I'm also hopeful. Hopeful that one day we will look back on these dark days of medicine, a time when physicians commit suicide at an alarming rate, and patients suffer the consequences of a morally injured medical workforce because doctors don't receive the benefits of wellness through mental health services. We will look back on these days as bizarre and illogical. Thank you.